We are live. We are live. We are live. Welcome to Medical Monday. I'm Dr. Frita, and we're giving you all of the hot health topics in the headlines. Today, we have a full show for you because guess what? The FDA has banned red dye number 3. Yes, it's banned red dye number 3. Why? Because it's been found to cause cancer in rats. But we've known this information for more than 30 years. So why are they just now banning it? We'll talk about it in my favorite game, myth versus fact. And then we'll talk about Princess Kate. Yes, Princess Kate has announced that she is in remission from her cancer. She didn't say what kind of cancer she had, but she is bringing awareness to all cancers. And so we'll talk about that. And then we will talk about the Quad-Demic. Yes, the infamous Quad-Demic. I'm talking about COVID, RSV, the flu, norovirus. And we'll talk about how to protect yourselves from these viruses. And let's not forget about Wendy Williams. Y'all know I love Wendy Williams. Well, we talked about how her caregiver, her guardian, announced that Wendy was permanently incapacitated. But then Wendy went on these different interviews and she sounded quite lucid, quite clear in thought. So we'll talk about what it means to have a guardianship. And do you think Wendy Williams needs a guardianship? And then we'll get into what it means to have guardianship abuse. We'll get into all of that today. And then would you like some tips on aging? Don't we all? Well, I will share with you a delicious juice recipe I have that actually has lots of anti-aging properties. We'll get into that. I think we all need that going into the new year. And then we'll talk about the rising costs of pharmaceuticals and who's at the top actually benefiting from the profits. And please make sure you go ahead and get your questions together, because at the end, I'll give just we'll do a few live Q&As. Yes, I'll answer your questions right here live. But if you really want a full session of live Q&A questions, be sure to join the Dr. Frita membership community. All right, go ahead and hit that like button, please, as we get started, because it's Medical Monday and we've got a great evidence-based medicine show for you. Keep watching. All right, we are live. I'm Dr. Frita, and I'm very excited to be with you on this very special Medical Monday. Happy Martin Luther King Jr. Day to everyone. And make sure, yes, go ahead and click that like button as you come in and share. Let people know that we are here on this special day. And I want you to check out my Instagram at dr.frita, because I posted how I was feeling this morning about MLK Day, and I kind of go over a speech of his that's quite relevant today. So after you finish this live, check that out. And please, Miss Shador, my practice manager and co-host, come on up to the stage.
Hey, Dr. Frita, happy Monday. Happy MLK.
Happy Monday. Happy MLK Day. You know what, Shador, when I go back and listen to his different speeches, and the fact that he was so young, he was so profound, and the words that he said ring true even now today, probably even more so today, if you can imagine. He just had such foresight and was just so far ahead of his time. And I just hate that he was taken away from this world so soon, but it really is amazing. He certainly deserved the Nobel Peace Prize that he won at any rate. But we are here, and we are here for Medical Monday, where we are giving all of the hot health topics in the headlines. And we've got a lot to talk about, Shador. Let's first talk about myth versus fact. Yes, that's my favorite game. Who was the first one in the chat, Shador?
First person today was Miss Aline. Hi, Aline.
Miss Aline, how are you doing? All right, welcome. All right. And in the chat, please go ahead and let us know where you're watching from, so we can give you some shout outs and see who's watching from the farthest place. All right, let's get started. You see that just this past week, the FDA banned red dye number 3. Now, we see red dye in some of everything, right? In that bright cherry red colored candy, beverages, frosting, things of that nature. But now the FDA has banned it. So, Shador, if you can get us started and read the first myth versus fact statement. And for those of you in the chat, I want you to write out myth 1, or you can write out M1 if it's a myth, or F1 if it's a fact for this first statement.
All right. Red dye number 3 has been proven to cause cancer in humans.
Red dye number 3 has been proven to cause cancer in humans. If you think it's a myth, put M1. If you think that's the fact, Jack, put F1. All right. In the next myth versus fact question, Shador?
Yes. It is obvious when red dye number 3 is in foods, beverages, because it is only in bright red items like red licorice, cherries, cherry soda, red sprinkles, and red frosting.
All right. For this one, put an M2 if you think that's a myth, but put an F2 if you think that it's a fact, that it's going to be obvious because it's only in the brightly colored foods. So it's going to be pretty easy to tell by glancing at something if it has red dye number 3. So an M2 if you think this statement is a myth, an F2 if you think this statement is a fact. That's right. We got to get these brains working. All right, pencils down. Okay, let's go back to our first myth versus fact. And let's see, did we have any participants? Does anyone think it's a fact or a myth? Who came up to play the game?
Yes, so Janet says F1. Hi, Janet.
Okay, you say that it's a fact that red dye number 3 has been shown to cause cancer in humans. Okay.
Also, Roni agrees.
Agrees that we found out in humans that it causes cancer.
Lisa as well says F1.
Hi, Lisa. You say it's a fact. Okay.
Therese says myth. M1.
Oh, Therese, why are you going to Breaking Bad? So you think it's a myth? You don't think they found cancer in humans with red dye number 3? All right, we'll see.
And Anton also says a fact.
Anton said it's a fact that it's been found in humans. All right. Now, who was that who said it was a myth?
Therese.
Ooh, Therese. All right. Well, the correct answer, Therese, is it's a myth. It's a myth. Red dye number 3 has been found to cause cancer in lab rats, but as of now, we have not found any evidence that it causes cancer in humans. It's only been found to cause cancer in rats. I know what y'all are thinking probably, well, that's enough for me. If it causes it in those mammals, it can cause it in us, and we don't want it. And ultimately, that's why the FDA has banned it. So the thing is, so red dye number 3 is actually a synthetic color additive, and it comes from petroleum. Okay, it's also called erythrocene. And for years, ever since 1907, the FDA has approved red dye number 3 to be used in the United States. But we found that large doses of red dye number 3 can cause thyroid cancer, specifically in male lab rats. And again, these are very large doses, larger than the amounts of red dye number 3 that we actually tend to ingest. So this did, bring everyone to a bit of an uproar. That's why back in 1990, the FDA actually banned red dye number 3 from cosmetics like lipsticks and from certain topical drugs. So we've literally known this information for more than 30 years. The FDA acted on it, banned it from lipsticks and cosmetics, but they didn't ban it from food or from all drugs, which really has a lot of people raising their eyebrows. But now we have the FDA has now banned it from foods, from drugs, from beverages. And we've also known that red dye number 3 has been banned from some foods in certain European countries. And California even took a stance before now. They banned red dye number 3 from some of their foods. So yes, red dye number 3 has been banned because it was found to cause cancer, specifically in male lab rats. It has not been found to cause cancer in humans. All right. I like my little tricky question. All right, what's the next question? Let's pull that back up and let's see. So if red dye number 3 is in your food, it's going to be obvious because it's going to be a bright red food like a candy, red sprinkles, red licorice, cherry soda. It's going to be pretty obvious at a glance. Is that a myth or a fact? Who weighed in, Shador?
Katina says a fact.
You said it's a fact. Okay, so you can eyeball red dye number 3 and be pretty confident.
Alicia disagrees. She says a myth.
Oh, Alicia, here go the controversy. So you think it might be in there and it's not super obvious, Alicia.
Ebony agrees. Ebony agrees with Alicia. She says a myth.
Who said it's a myth?
Ebony.
Okay, so Ebony and Alicia, you're like, nah, it's not always obvious. Okay.
Arville says fact.
Arville says it's a fact. You'll be able to glance that it's there by being bright red.
And Sheila also says fact.
Sheila says it's a fact.
Mm-hmm.
All right. So drum roll. You will know that red dye number number 3 is in a product because it will be obvious. It'll be bright red, like red licorice, red cherry soda. It's a myth. It's a myth. So who was that? Ebony? And yeah, you were correct. It's a myth. So here's the scary part. I want y'all to listen carefully. Yes, so you are correct that it will be in, red sodas, all those things that are bright red frosting. But get this, red dye number 3 can also be found in some mashed potatoes, some yellow rice. Do you ever see the farm-raised salmon that's like really bright pink and perfect? Red dye number 3 has been found in some salmon. It can be found in some vegetarian meat substitutes. It can be found in some protein shakes and even cough syrups. So the point is that you want to be a label watcher because it's not always obvious. And you want to look for red 3 on the label or FD and C, red number 3. Let's go ahead and play this clip that gets more into red dye. Shador, please.
All right.
The FDA is banning the use of red dye 3. This is the synthetic dye that is in countless cereals, candies, fruit cocktails, and more to give, that bright red cherry color, right? Well, at least 2 studies have shown that high levels of this particular food dye were linked to cancer in rats. However, the link between the dye and cancer has not been proven yet in humans. Food companies have until 2027 to make these changes. Red number 3 dye has been banned in Europe for decades. I mean, this is just the tip of the iceberg. There's there's red dye 40 that's in a lot of commonly used products, food products. So, I mean, it's a step, it seems, in the right direction, but we shall see.
Yeah. So a lot of people have been outraged. And make sure after you finish watching this live, I want you to check out my Instagram at dr.frita. And remember, I have a lot of content on my Instagram and on my TikTok, now that TikTok is here, and Facebook. I have a lot of different content on there than I have here on YouTube. And for those of you who are new to the YouTube channel, so I am Dr. Frita. I'm an MD. I'm a medical doctor who has been board certified in nephrology. So I'm a board certified kidney and high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and most recently, I received my board certification in obesity medicine. And so I like to learn a lot about a lot. And most importantly, I like to share a lot. And so thank you for being on this channel with us for our Medical Mondays, our YouTube lives. We're here every Monday, noon Eastern Standard Time. And we have hundreds of videos on the Dr. Frita YouTube channel, where I'm very proud to say that we have over 820,000 subscribers. Thank you to all of you. So if you haven't subscribed, I don't know what you're doing. Come join the party. I give very good evidence-based information over there. And then on my Instagram, I give a little different spin on information. So if you check out my Instagram at dr.frita, I posted over the weekend a video on red dye number 3 where I go into more detail, and it's in a nice, short, digestible soundbite that you can share with friends on what to know about red dye number 3. Also, this past weekend, I was on Good Day Atlanta. If anyone got a chance to catch me on that, it was here on our local Fox 5 Atlanta, Good Day Atlanta on Saturday morning. Put in the chat if you got a chance to catch me on Good Day Atlanta. And I talked about health headlines in the news. And so I got a chance to be on there and give that a chat. All right. So that is the deal on red dye. Now, a lot of people who responded on my Instagram, some people in the DM, some people to me directly, were really frustrated because they're like, if we've known that it causes cancer in lab rats for over 30 years, then what took so long? Why did the US allow us to be ingesting this for over 30 years? And here's the thing, just because the ban has occurred now, it doesn't mean the red dye is being removed immediately. The FDA is actually giving food distributors until January 2027 to actually have to remove the red dye number 3 from all of its products. So you can still be legally ingesting red dye number 3 without knowing it. That's why you must be a label watcher. But I want you to put in the chat how you feel. Do you feel like it's an outrage that the FDA waited over 30 years before banning it from foods? Or do you think, it hasn't been proven to cause cancer in humans, just in rats, so it's okay? So if you feel some kind of way, put that in the chat, and we'll see if we can get to a couple of your comments. Meanwhile, let's talk about solutions, right? We like to be solutions oriented on this channel. So what can you do if you still want to color your foods or have a pretty nice red or pink color without using red dye number 3 and having any potential cancer exposure? So you can use things like beet juice or beet powder. Okay. Different things that are natural, more like fruits, vegetables, herbs, plants that have red colors. That's considered to be a safe way to have a reddish red food coloring. So yeah, so beet juices or powders, or even pomegranate juice. In some cases, a cranberry extract or different purees of that sort. You can also do hibiscus. Hibiscus flowers can also help to give a red coloring. So there are alternatives, but again, make sure you look at your labels. And if it says red 3 or FD&C red number 3, then understand that it has red dye number 3, which has been proven to cause cancer in male lab rats when used in large amounts. All right. So did anyone make a comment? They feel like the USA did us wrong, or they feel like, yeah, it's okay. It makes sense. Because again, who said something?
Therese, she said, I'm outraged that it was hidden from me.
Yep. And it's, you would have to be probably in the medical field, in the scientific field, to look it up, because again, in 1990, they did ban it from lipsticks and topical drugs. But if it's important enough to ban for things that you put on your body, why wouldn't you ban it from what's in your body? And to be fair, you've had different people in Congress, different groups have been trying to push, but unfortunately, the way things work in the higher ups is that they don't always move as quickly as they need to. So here we are more than 30 years later, and now they're banning it. And even still, like I said, it'll be 2 years. Yeah. But I'll be honest, that's frustrating to me as well. And that's why it's important really to avoid ultra processed foods as much as you can altogether. We know that they are poor for your health, poor for heart health, and a lot of ultra processed foods can put you at increased risk for cancer. Okay. Anyone else?
No.
All right. So speaking of cancer, let's talk about Princess Kate, because fortunately she made the announcement that her cancer is in remission. Let's play that clip, please.
This morning, hopeful news for Princess Kate, announcing her cancer is in remission, marking the moment by visiting the Royal Marsden Hospital, where we now know she underwent cancer treatment. Met by roaring staff who were all rooting for her recovery before taking time to share intimate moments with cancer patients.
She seemed to really have an understanding of what they were going through,
offering comfort to a battle and a journey she now knows so much about.
I've just had a pork pudding and she had the same. So it was nice to hear from somebody else who's gone through the same thing that it does get easier.
The Royal Marsden, one of the most specialized cancer centers in the UK. Kate now joining husband William as a patron, following in the footsteps of his mother, Princess Diana. The princess taking to social media to thank the staff, writing, "My heartfelt thanks goes to all those who have quietly walked alongside William and me as we have navigated everything. It is a relief to now be in remission, and I remain focused on recovery."
All right. So I'm very happy for her that she's in remission. And remember, the royal family is always extremely secretive, or so it seems. And so I remember I was shocked that they even announced that she had any type of a cancer, and I don't know if it was motivated by a paparazzi or some leak, maybe she got ahead of the story, but she still has not revealed the exact type of cancer that she has, and it looks like she won't. And they offered the explanation. They said that she just wants to be sure to focus on all cancers and not just her cancer. I want you to put a 1 in the chat if you think that that's probably right, what she's saying, that she just wants to focus on all cancers. Put a 2 in the chat if you think that she's hiding the type of cancer for another reason, and give me an explanation after that too, like what could be a reason of her trying to hide the type of cancer, and then we'll get to it. All right. Meanwhile, since she does want to highlight all cancers, which I think is remarkable, I want to do the same. So I want you to put in the chat give me a type of cancer where we do have a routine screening for. So put that cancer and put the routine screening, and then we'll get into the details as you go ahead and put those in there. All right. Meanwhile, did anyone say where they're watching this from, Shador?
Oh, yes, ma'am. Absolutely. So we have Janet.
Hi, Janet.
Watching from Houston, Texas.
Hey, Houston, Texas, baby. Home of Beyonce. Thank you for joining us. Please make sure you give us a like and share the video, because we're going to give you some evidence-based medicine here today, like we do every Monday and like we do every day here on the Dr. Frita channel. Who else?
We have Lisa joining us from
Lisa.
Miami.
Welcome to Miami. You know, I'm from Florida. I grew up in St. Petersburg. Oh, and my daughter, okay, y'all know my daughter is a freshman at FAMU. FAMU. And so she's a member of the Marching 100. Yes, the best band. According to ESPN, they won Band of the Year. Thank you very much. She's a trumpet. And they did some traveling over the weekend, Shador. They played in a Palm Beach parade this weekend, honoring Martin Luther King Jr.'s birthday. And then they played in a jamboree. And now they're actually in my hometown, St. Petersburg, Florida, where they played last night. And then today they marched in the Martin Luther King Jr. parade, which is a huge deal in our city, and my baby's down there being a part of it. All right, so Miami, Florida. All right, that's good. Okay. Did anyone have any comments on Princess Kate not sharing it? They think, one, they believe that yes, she just wants to highlight all cancers, or two, they think there might be another reason that she's not sharing the specifics, and recognizing her privacy is her right. Okay. You know, of course, when you're someone who's in the headlines and when things are out and about, we tend to be curious. And sometimes we forget that you don't owe us an explanation. Now that's clearly true, but I'm just, I do have my thoughts on why she's not sharing the specific cancer, since it's out there anyway. Anyone?
Yeah. So Therese placed the 1.
Okay. She just wants to highlight all cancers.
As was Lisa. Lisa placed the 1, and Lisa also mentioned one of the cancers that we have screenings for your second question.
Okay, good.
And she said breast cancer.
Absolutely, yes. So breast cancer, we know that breast cancer is very common. It's common, of course, in women, but men can get breast cancer too. In fact, 1 out of 100 cases of breast cancer occurs in men. And so you should be having the conversation with your doctor about breast cancer at an early age, even as early as 18. But it is recommended that women be screened at least by the age of 40 with a mammogram. And we used to have the 2D mammograms, but now we have really the more intensive, more specific 3D mammograms. And so if you're someone who has dense breasts, and a lot of young women and a lot of Black women tend to have dense breasts, the 3D mammogram actually picks up more cancer than a 2D mammogram. So make sure you ask when you get your cancer screening for the 3D mammogram. Now, in some cases, your insurance may not cover it, but I don't want you to be discouraged. I want you to either ask your doctor to do a pre-authorization to say, hey, I've got dense breasts, or hey, I'm at high risk. I'd like to get a 3D mammogram. And then if that fails, ask for the cost, because a lot of us spend money that we probably shouldn't be spending on extra specialty coffees, getting Uber Eats and DoorDash and doing all these extra things. I'm telling on myself. And if you found out that the 3D mammogram would only cost you $100 more or $150 more, you might make that choice. So don't just, go away when they say the insurance company is not covering it. Try to get a pre-authorization, and then specifically ask for the cost to see if it's something that you're willing to do. Okay. And so if you are someone who has a family member, like a first-degree relative who's had breast cancer, then it may be recommended that you have your mammogram 10 years before that relative. So, for example, if your mother or your sister had breast cancer at the age of 40, it may be recommended for you to have your mammogram by the age of 30. So make sure you have the conversation with your doctor and stay on top of it, because with all of these screenings, we're catching breast cancer at earlier and earlier stages. And with early detection, early screening, we're able to decrease the deaths from breast cancer. Okay, so that's good. Yes. Anyone else?
Yes, Roni chimed in. Hi, Roni.
Hi, Roni.
This is cervical cancer, pap smear testing, and joining from Stonecrest.
Hey, welcome from Stonecrest. Isn't there Stonecrest Mall? I used to go to Stonecrest Mall. Oh, it's been a long time. I have an auntie who lives that way in Lithonia, but I think they don't even call it Lithonia anymore. They changed the whole name. Anyway, but yes, cervical cancer. And so we do have cervical cancer screening, as you stated, the pap smear. And if you are a lady and you're sexually active, talk to your doctor or your pediatrician, depending, and for young ladies like teenagers, your pediatrician should give you a way to talk to her without your parent in the room. Okay. And as long as you're not doing anything that's life threatening to you or to someone else, your pediatrician should hold your confidence. For example, when I did my med peds residency at Georgetown, my internal medicine pediatrics residency, I would always ask the parents to leave, especially for my teenagers, and even as young as young as the age of 11, depending on what I was sensing, I would have the parents to leave the room. And if I had a parent who really was more of a helicopter mom or was like, you tell me, I want to hear everything about my child, I would come up with the reason. I might say, hey, mom, stay right here. I'm going to walk with Jenny and we're going to get her weight. And then I could quickly be like, Jenny, are you kissing boys? Are you sexually active with boys? I'm not going to tell your mama, blah, blah, blah. So if any teenagers happen to be listening, and if any moms are listening, you're doing yourself and your child a disservice if you absolutely refuse to let them have time alone with the pediatrician. You want your child to be honest. At any rate, so yes, if it's a teenager who's sexually active, then it may be recommended at an early age that the child has a pap smear, certainly by the age of 18 or 21. Consult with your doctor to find out when it's appropriate for you to have a pap smear. But having the pap smears can detect cervical cancer early. And there's so many treatments when it's caught early, like when the cells of the cervix are first abnormal. They can do LEEP procedures. They can do cone biopsies. Basically, they can get rid of those damaged cells or those precancerous or cancerous cells. And then you could, boom, not have cervical cancer. And so it really is so sad to me when I see that people, do pass away, and I have some people close to me, in my family who have had cervical cancer, even currently. And I also have, I remember, oh gosh, young ladies, one in particular who was only in her 30s, and she had a house full of children and was a single mom and had cervical cancer. And I always just thought, if only someone had just really pushed and stressed the importance of having cervical cancer screening with something as simple as a pap smear, she could still be here. So yes, have that conversation. Now, here's another question that I have. Cervical cancer actually can be preventable. So it can be detected early with the pap smear, but it could be prevented with a specific vaccine. Does anyone know what vaccine can actually prevent cervical cancer? I'll give folks the time to put that in the chat. And then did anyone else put a different type of a cancer or a screen?
Yes. Dr. Frita will call Miss Therese she's head of the class today.
Well, come on to the front.
From Temple City, Cocoa. So she's trying it with a couple of other cancers.
Okay.
Prostate, thyroid, and colon cancer.
Okay. So for the prostate cancer and for the colon cancer, you're absolutely correct, as in having a routine screening. For the thyroid cancer, if your doctor is suspicious, like if they feel a lump or something like that, then yes, they can do an ultrasound or they can do some imaging. But the thyroid cancer is not one of the ones where we routinely say, everyone by the age of such and such, go get a thyroid cancer screen. That's only something that if your doctor is suspicious, they will give you a screen for. But when it comes to the prostate cancer, yes, we do have and recommend routine prostate screening. Now, it's controversial as far as what age and what type of screening, but certainly by no later than the age of 40, men should be having a conversation, or anyone born as a man should have a conversation with their doctors about prostate cancer screening, because we know that's a very common cancer. And prostate cancer, specifically among Black men, tends to be more aggressive, tends to be diagnosed at earlier ages. And so one of the prostate screenings is a PSA, the blood test, prostate specific antigen. And so you can get screened with that number to see if it's something that's worrisome. If it's more than 4.0, that's outright abnormal. But even if it's higher than 2.5, that may trigger your doctor to do more screening, such as a prostate MRI or a prostate ultrasound. The prostate MRI actually tends to be more specific, and it's an excellent screening for prostate cancer. So at least by the age of 40, have the conversation. And then again, if it runs in your family, then you are considered to be at high risk. If you are a Black man, you're considered to be at high risk. And, and throw in the chat, please, if you know of some of the celebrities who have recently either just had prostate cancer, who have actually passed away with prostate cancer. We've talked about some of them here. Okay. And then, oh, yes, the colon cancer. Absolutely. That's a big one, big one, big one. And yes, you are correct. We do have routine screening for colon cancer. If you are of average risk, then by the age of 45, it is recommended that you be screened for colon cancer. Now, the gold standard is the colonoscopy, which, yes, is literally when there's a camera and it's put up your bottom. Okay. You have to do a prep. And if you go to my Instagram at dr.frita after you finish this live, you'll see where I had my colonoscopy in December. I had an attitude because I'm gonna be honest with you. I did not like that prep. I didn't like the prep. I'm not trying to be a baby. I'm just trying to be honest. But after all of that was said and done, the colonoscopy, that went really smoothly. I had a great doctor, Dr. Nicole Gordon. Hey, Atlanta Gastro, Black female, wonderful doctor. Anyway, but yes, by 45, if you are of average risk, it's recommended that you be screened. So the colonoscopy, yes, that's a gold standard. People used to talk about the sigmoidoscopy, but that only takes a look at a portion of the colon. And I don't want people to look at a portion of the colon, get the whole colon looked at with the colonoscopy. There are also some other DNA tests, like where you can do a stool sample and they can test you genetically. Consult with your doctor on what's appropriate for you. But I will say colonoscopy is the gold standard. But yes, that's another good one. So yes, as far as routine. Okay.
The vaccine, Dr. Frita, you asked about to prevent cervical cancer.
Yes. What vaccine? Ooh, I want to know who got this one. Did they get it right? Did you get it right? Okay.
So Arlene chimed in with HPV.
Arlene, you come on up to the front of the class. Absolutely. HPV, human papillomavirus, is a vaccine that can literally prevent cancer. Okay. It can literally prevent cancer because we know that cervical cancer is most often caused by the HPV virus. And yes, HPV is considered to be an STI, sexually transmitted infection. Don't get all freaked out. Don't think, oh my gosh, my doctor told me I had HPV. I'm gonna go beat up my partner. Please don't. Because the sneaky thing about HPV is that if you have it, you probably don't know it. You usually don't have symptoms. If men have it, they usually don't have symptoms. And it's ubiquitous. It's literally everywhere. Okay. And so many people have HPV. So don't think, oh, they gave me something. Oh, they're nasty. No, it's just one of those things. It's just out here. And so if you do have HPV, yes, in some cases it can cause genital warts. It can cause warts in the anus. It can cause warts on the penis. But more seriously and more dangerously, it is the most common cause of cervical cancer. But if you get an HPV vaccine, which now it's offered in children, as young as 9, 11, they can get the HPV vaccine. And then it's very likely, not only will they likely not get cervical cancer, they also likely will not get certain oral cancers, because we do have people who've shared that they've had oral cancer that's caused by HPV from having, oh gosh, what can I say on YouTube? From having oral romance, we'll say that. Okay. And so we know that the tennis pro Martina Navratilova had it, and it's been reported that her, and I'm talking about throat cancer, oral cancer, hers was related to HPV. And then also, oh my gosh, I don't want to get the wrong name. My guy, star of Fatal Attraction, married to Catherine Zeta-Jones, Michael Douglas.
Mm-hmm.
Okay, he had oral cancer as well, and he's reportedly had his related to HPV. Okay, so this is just what it is. Okay, and so, and with my theory, I don't know if anyone put a 1 or a 2. We had the 1s for Princess Kate. I don't know if anyone put a 2, but in my thoughts, and of course I don't know, but just putting my 2 cents in, I would imagine that if Princess Kate had cervical cancer, and I don't know if she did or if she didn't, knowing that fact, she might be worried that people might say, oh, you got cervical cancer. Do you have HPV? And perhaps she would think that she'd be judged, or perhaps that wouldn't be fitting of a queen. And so that's my only thought on why she wouldn't share what type of cancer. I don't know, but that's just me kind of speculating from my perspective. All right. Anything else? Y'all just about hit most of them. Let's see. You said breast cancer, cervical cancer, prostate cancer, colon cancer. There's another one that we do have a routine screening for certain people. Not everyone is eligible for this screening. And that's lung cancer. That's lung cancer, but only if you are a smoker or if you've been a smoker. If you have at least a 20-pack year history of smoking, meaning that you smoke an average of a pack of cigarettes a day for 20 years, or say an average of two packs of cigarettes a day for 10 years. Okay, 2 times 10. If you have that, and even if you quit smoking, if you have smoked within the last 15 years, and if you're between the ages of 50 and 80, it's recommended that you get screened for lung cancer by a low-dose CT scan. And who can tell me what rapper's mom recently passed away with lung cancer? Did anyone mention any of the prostate cancer folks, Shador? That's jumping out at you.
Michael Douglas.
So yeah, it was Michael Douglas for
Alicia
the
chimed in and said Michael Douglas.
Yeah. Have y'all seen
Therese she said lung cancer, but then she took it back. But Therese,
you were right when you said lung cancer. But you see, and that's relatively new. It's relatively new because there was a time when we wouldn't screen because we're like, oh, everybody's not at high risk. But then now we've narrowed it down. You only get screened if you are in high risk and you fit those things, all of those things, the 20-pack year history, and between the ages of 50, 80, and even if you quit, you smoked within the last 15 years, then a low dose CT. Yeah. See, go with your first gut.
Yeah, Therese is on it today.
Yeah, I love it. Thank you for participating. Y'all, make sure you go ahead and give this video a like. Share it with the people you care about. Share it. Go ahead, share it in your group chats. Share it with the people who you know are off today and sitting around down to the house, eating pie, not doing anything, and they could use some medical information. If you share, it lets YouTube know that we're here, and it helps with the algorithm. And for all of those of you who are catching me in the replay, my replay crew, please also go ahead and give us a like and a share. We're giving you evidence-based medicine here, and we definitely appreciate you. All right. Let's talk about something that's not fun, but that's here. The Quad-Demic. I know nobody wants to hear about the Quad-Demic. Well, guess what? It's here to hear about you. So let's go ahead and play this clip, and we'll talk about how we can try to avoid this thing.
And now to a health alert. Doctors are warning tonight of a possible so-called quad-demic this winter.
Data from the CDC shows cases of flu, COVID, RSV, and norovirus are all on the rise. Dick Brennan has more on what to do to protect yourself.
You've been feeling under the weather, you've got plenty of company. Flu cases are surging. In data from the week ending December 28th, cases in New York State jumped 42% from the previous week, and rates are high in New Jersey, Connecticut, and 37 other states nationwide.
We haven't seen the level of influenza we're seeing this year since before the pandemic.
And Dr. Daniel Varga with Hackensack Meridian Health System says it's not just the flu. There are a total of 4 viruses in the mix, a potential so-called quad-demic.
Well, you've got COVID, flu, RSV, and now you've got norovirus that's in the mix.
I thought it was a sinus infection. I had no idea.
Pam McLaughlin went to urgent care and found out she had 2 viruses.
The doctor came, she said, I'm shaking my head because you got a double whammy. You have COVID and the flu.
Why the spike now among the contagious viruses? It's likely related to holiday gatherings and people being indoors during the colder weather.
I think the next 3 to 4 weeks may be very difficult.
So what to do? The health department advises getting vaccines.
In influenza, we've got vaccines in place that kind of guess on what the most likely strain is going to be that year. It just so happens this year, we're lucky the flu vaccine is really, really good this year in terms of preventing it.
Doctors also recommend you get the COVID and RSV vaccines. And to add protection, well, you've heard this one before.
Wash your hands with soap and water, the old-fashioned way.
For 20 seconds.
I always tell people say the ABCs or sing happy birthday.
You can also use hand sanitizers, but they won't work against the norovirus. So to cover all bases, just keep washing your hands.
All right, the Quad-Demic. 1, 2, 3, 4. That's a mess. All right, I want y'all to please put in the chat if you or a loved one, only if you care to share, has had one of these viruses from the Quad-Demic. You or a loved one, if you've had any of these RSV, COVID, flu, norovirus. And also, please put in the chat if you have been vaccinated, for the ones that have vaccines, against anything from the Quad-Demic. So please share if you've had the COVID vaccine, the flu vaccine, the RSV vaccine. There is no norovirus vaccine. Sorry. And again, only share if you feel like sharing, because HIPAA is not in effect on this. Anybody can see it. Okay. So only share if you don't mind your business being out there. No shame. Mm-hmm. All right. So yes, we've got the Quad-Demic. And it's something, because I feel like people aren't really talking about COVID, the C word, but it's still here. People are still getting the COVID. People are still passing away from COVID. And we do have COVID vaccines. And, no, thankfully, it doesn't seem to be as virulent. It's not causing as many people to lose their lives as when, back in 2020, 2021, but it's still here. So especially if you're someone who's elderly, if you're over the age of 65, if you're immunocompromised, if you're on chemotherapy, if you have an autoimmune disease like lupus, rheumatoid arthritis, sarcoidosis, if you are take a transplant patient and you're taking certain medicines to push your immune system down, or if you're someone who's in a high risk field, like if you're a doctor, a healthcare worker, a nurse, where you're around people and you're more likely to encounter someone who has COVID, consult with your doctor on whether or not it's appropriate for you to get the COVID vaccine. Is still here. Same thing with RSV. And, I can go ahead and put myself in the chat of having family members who have had the RSV this season, and the family members I have who had it were definitely over the age of 65 and are considered to be at high risk. And we know RSV is a respiratory syncytial virus, is something that can cause people to get very sick and to lose their lives, especially if you're immunocompromised. And then we all know about the flu, influenza, and we've got a few mixes of the flu going on that I want to talk about. But with the influenza, it's recommended that everyone 6 months of age or older, is recommended by the CDC that we be vaccinated against the flu. And here's a trick with the flu this year in particular. So yes, the seasonal flu is the one that we talk about every year. And the reason we have a different vaccine every year is because the doggone virus mutates every year. Okay, it changes. And so we try to stay ahead of it. And you get the seasonal flu vaccine. And some people say, oh, I got the flu vaccine, but I still got the flu anyway. And yes, that can definitely happen, because I'll raise my hand. I know another elderly, a few people in my family where it happened to them. But here's what we believe, that at least if you have the flu vaccine, then the case of flu that you get is likely not to be as severe as it would have been, because people do lose their lives from the flu. They can get a pneumonia associated with it. They can get an encephalitis or inflammation of the brain, and they can head on out of this world, especially elderly people and immunocompromised people or very young people. Okay, so that's that with the influenza. But here's the other trick with the influenza. We know that we also have this bird flu going around. And when I was on Good Day Atlanta on Fox 5 Atlanta here just this past Saturday, and make sure you follow me on Instagram, because I am going to post that either later today or certainly by tomorrow. I'm going to post my interview. I was talking about the bird flu because, Shador, did you know right here in Georgia, we got another case this past week of bird flu in another poultry plant. So that meant that all the poultry plants within a 6-mile radius had to be quarantined for the next 2 weeks. So keep an eye on your price of eggs and your price of chicken, because they cut all the conditions. And so the human who got the bird flu was someone who was working with poultry. And we know that with the bird flu, it's typically found in wild birds, and it's in their saliva, it's in their droppings. And so it can go to, turkeys, it can go to ducks, it can go to geese. And, we first found out about the bird flu back in 1996 in wild geese in China. And at that time, for all the humans who got it, there was an over 50% mortality, meaning that over half the people who got the bird flu passed away. So that's why we're really worried about it in humans. Right now, there's still no human-to-human transmission of the bird flu. But here's the thing, and this is where it takes us back to the regular flu vaccine. If you are a human and you get infected with the seasonal flu, and you also get infected with the bird flu, well, there's a possibility that the genetics can do some type of intermingling, mutating, and some swapping, and you having those co-infections, the two things at the same time, could make it possible that a strain comes out of there of the bird flu that's more likely to go from human to human. So if for no other reason, getting the flu vaccine and trying to keep yourself from getting the flu, then that means that if you were to unfortunately get the bird flu, then at least you won't be the host that ends up giving us a human-to-human transmittable version of the bird flu. Consult with your physicians and just give yourself all of the protections that you can. Okay. Did anyone share whether or not they've had someone, a loved one, or themselves this season with one of the?
Absolutely. So shout out to our member, Miss Cynthia.
Hey, to my member, Cynthia. Cynthia, on next Monday, January 27th, we're having our live Q&A where we'll spend the whole session live Q&A, interacting. You can ask a question, make a comment, we'll have a conversation. So for anyone who wants to join us in our membership community, make sure you click the link in the description, and you too can join us for the full time where we're just talking back and forth. All right, Miss Cynthia, who'd you know who had it?
So she said a sister. And she said she's had all three except RSV.
Oh, geez. Okay. Oh, as far as the vaccines.
Vaccines, Miss Cynthia, you actually was sick this season.
Oh, I hope you weren't sick, Miss Cynthia. All right. But thank you for sharing and thank you for being a member.
Yeah. Bobby. Hi, Bobby.
Hey, Bobby.
Bobby says they've got strep plus COVID 3 weeks ago.
Oh, isn't it a mess when you have more than one thing? It's like, I feel like when you get one infection, it just takes your immune system, it makes you susceptible to another one. Strep throat is a mess. I've had that before. It feels like you're swallowing shards of glass. I can't stand it. And one of the ways to know, you definitely want to go and get tested like you did. And I hope that you're doing better. But with strep throat, so we think about just like a regular cold or a regular virus, then you might have a fever and a lot of runny nose, coughing, things of that nature. With strep throat, you'll tend to have swollen glands, right? Swollen lymph nodes in the neck. And you may not have that much of a runny nose, but oh my gosh, it's that sore throat. Oh my goodness. All right. Well, I hope y'all are doing better with that. Yeah, that's one. And so strep pneumonia is a bacterium. It's not one of the quad-demics of the virus, but goodness gracious, it is here and it can get you real sick.
And Miss Cynthia clarified. She said, yeah, all the vaccines.
Oh, good work. Protect yourself any way you can. That's good.
Tisha chimed in. Tisha said her grandson had COVID and flu.
Oh, poor baby. Yeah, that'll get you. But yeah, so just make sure you consult with your doctors, and for the kids who get sick, really adults either. If you're not able to hold down any beverage, if you're getting dehydrated, if it's a baby and they're making decreased wet diapers, then you do want to consult with your doctor, right away. Don't sit on it and let the baby get very dehydrated. Okay. All right. And who can tell me of everything in the Quad-Demic, which of the viruses is not killed by hand sanitizer? Is it COVID, RSV, flu, or norovirus? One of them is not killed with hand sanitizer. So you need to wash your hands with soap and water. Anyone jump in?
Not yet.
All right.
Cynthia said COVID.
COVID is killed by hand sanitizer, we believe. And also Lysol. Did y'all remember back in 2020, did anybody look at the back of their Lysol bottles and be like, coronavirus? And it's like, wait, is this a conspiracy? Did they already know? Well, no, we call it COVID. We talked about coronavirus like it was new, but coronavirus is also just one of those upper respiratory infections that we've known about for decades and decades and decades. But the specific COVID, that SARS-CoV-2, was a new form of the coronavirus.
Yeah. All right. Bobby has chimed in. Bobby and Sheree.
Hi, Bobby, and hey, Sheree.
Says norovirus not killed with hand sanitizer. Norovirus not killed with hand sanitizer.
That's absolutely true. Yes. I mean, it doesn't work well with norovirus, the hand sanitizer, which is scary because we know norovirus, they also call that the cruise ship virus. And norovirus is actually the most common cause of vomiting and diarrhea in the United States. Okay. And it's the most common foodborne infection in the United States. Did y'all know that? Norovirus is a mess. It's a hot mess. It's a big deal. And yes, it can cause vomiting, diarrhea, headaches, cramps, flashes. It usually only lasts for a few days, but my gosh, if you get really dehydrated, you can get to some very serious complications and even be unalive if you're someone who's vulnerable. Make sure after you finish watching this live, you check out my video on Facebook where we have well over 1 million views, where I talked about norovirus infection and Lil Scrappy. Lil Scrappy, the rapper on Love and Hip Hop Atlanta, he shared on one of his posts, his social media posts, that he and at least 2 of his kids had norovirus, and he lost 10 pounds unintentionally, and he described it in detail. But on there, I give you more details about norovirus. So check me out on Dr. Frita Facebook. I also have it on my Instagram channel as well. So check that out after you finish watching this live. And so, yes, if you're on a cruise, have fun, but wash your hands with soap and water in addition to just using sanitizer, because it does not work well. Hand sanitizer does not work well on norovirus. All right. Can we talk about Wendy? How you doing? All right. Put a 3 in the chat if you used to watch the Wendy Williams show. Put a 3 if you used to watch the Wendy Williams show. I know I did, y'all. I'm a Wendy Williams fan. I'm not going to pretend like I'm not. And we know that we've talked right here on this live on how she is in a guardianship. And I know you hear guardianship, you hear conservatorship. It just depends on the state. So like in New York, it's called a guardianship. But then in California, when we talked about Britney Spears, it's called a conservatorship. But it's basically the same thing, where a person is deemed to be incompetent as far as making their own decisions. And so the court appoints a guardian to the ward. So in this case, Wendy Williams would be the ward. And the guardianship can be a personal guardian and or a guardian of assets. So if it's someone who's a personal guardian, then they make all of your decisions as far as your medical care, your social outings, your travel. Okay, they make all of those decisions. And if it's also the guardian over your assets, then they control your bank accounts. They even control lawsuits. They control everything, that all of your assets, all of your property. And so we know that back when Wendy had that documentary, what happened to Wendy Williams, they talked about her having a diagnosis of frontotemporal dementia, primary frontal aphasia. At one point, someone alluded to her having an alcohol-induced dementia, addictions, different things of that nature. Make sure after this live, you check out right here on the Dr. Frita YouTube channel. I have check out my playlist, Wendy Williams. So if you go up to the YouTube search bar, Dr. Frita, Wendy Williams, or if you go to my channel and you look under playlists and you scan for Wendy Williams, you'll see where I did a 6-part series. I go into detail on the different diagnoses that she has according to her guardian. Okay. And quite honestly, I'm not sure how much I trust what's coming out of the Guardian, Sabrina Morrissey's mouth, if I may be honest, based on what I'm seeing now, because the Guardian said that Wendy Williams is permanently incapacitated, meaning that permanently she will require a guardian. But then Wendy Williams went on some interviews with Don Lemon, with Charlemagne and the good folks at the Breakfast Club, Hollywood Unlocked, Jason Lee. And at least during those interviews, you might question whether or not she seems permanently incapacitated. In fact, let's take a look. Let's hear firsthand how she sounded on the Don Lemon interview.
But here is my conversation with Wendy Williams. Hi, Wendy.
Hi, Dawn.
Wendy, I miss you.
Dawn, look, my phone is with the guardian person. You know what I'm saying? This phone that I'm talking on is a phone where I can call you, but you can't call me. I've never heard of a phone like this in my life. Anyway, it's good to talk to you.
It's good to talk to you. They didn't take your phone after this interview you did with Charlemagne, did they?
Listen. Look, my life is ridiculous. You know what I'm saying? I've been with this guardian person for 3 years. For 3 years of my life, look, I'm isolated. I feel like I'm in prison. You understand? I can't go out. All I can do is look at the window, and anytime I go out, it's because I'm going out with the person that the guardian has assigned to me. So if I want to go out, for lunch, you know what I'm saying, then I have got to go with this woman. You know what I'm saying? If I want to go out, like my dad turned 94,
and you can't go. Wendy, let me ask you this. I heard the interview, and I want to cover some things that didn't happen in the interview. Now, do you remember the last time that you were at the house, and I'm just going to be honest, you took your wig off, and we had a real heart-to-heart, and I was like, here's the real Wendy. And I said, Wendy, would you ever go on without your wig and do a thing with me? You said, no, because this is how people know me.
Okay. All right. I just want y'all to please put in the chat. And of course, I know we don't know everything, but just seeing how Wendy interacted with Don Lemon, and especially if you're someone who did get a chance to listen to the Breakfast Club interviews or the Jason Lee Hollywood Unlocked, tell me based on what you're seeing, if it seems like Wendy is permanently incapacitated to you, and do you think that she should have the guardianship? Please comment. Yeah, put a comment about it on what you think about Wendy Williams in the chat, and put a WW at the beginning of your comment so we can kind of scan through and know that it's a Wendy Williams comment. Put a WW at the beginning of your comment. So yes, it really is tricky watching her. And yes, sometimes people with dementia can have on days and off days, but when you think permanently incapacitated, now for those of you who actually watched that documentary, she did seem pretty incapacitated in that documentary from a year ago, right? She was obviously confused and sometimes combative, and sometimes where she just seemed like really she wasn't there. She wasn't quite lucid and she wasn't clear in thought. That was over a year ago in that documentary. but she does seem quite different to me, at least in the snapshots that we have of the different interviews. And permanently incapacitated, that's pretty strong, meaning absolutely for the rest of your life, you will need a guardian. But then the other question is, why is the guardian this stranger, essentially, this Sabrina Morrissey, and why is it not her family? And just to give you background on her family, Wendy's sister is an attorney. Wendy's niece, to whom she's very close, Alex Finney, is a journalist. She's on television in Miami. Okay. She has her son, Kevin. He's a young person. He just graduated from college, but he's young, but he seems pretty responsible. But at very least, her sister and definitely her niece, who's, older, a full adult. So the question is, why would they not be considered as far as being guardians? That's my question. But meanwhile, while you put in there your WW and whether or not you think that should be a guardian, and also comment on what you think maybe a happy medium could be for Wendy Williams. But yeah, I do want to talk about guardianship abuse. And just briefly, I'll say that Wendy in these interviews feels like she's being abused. She calls it emotional abuse. And so let's talk about some of the characteristics of guardianship abuse, because that's a real thing. So if a guardian is neglecting, physically abusing, psychologically abusing, intimidating a ward, the person they're supposed to be guarding, then that's considered guardianship abuse. And, even with Britney Spears, they felt that her conservatorship, ultimately it was ruled that the conservatorship was no longer necessary. And you can, say what you want and whether or not you agree with that. But there has to be some type of a happy medium. So for guardianship abuse, it would be considered neglect if Wendy weren't being fed properly or not in the shelter. It sounds like that's not the issue, but intimidation is also considered to be a component of guardianship abuse. And Wendy Williams fears in these interviews, she states, and her niece as well, that there's a fear that there's going to be a retaliation or an intimidation, meaning maybe your phone will be taken from you now that you're going out and you're in social media, or maybe I won't let you go see your father for his 94th birthday. Those types of things are intimidation. And if that's really happening, that's considered to be guardianship abuse. Also, the psychological abuse. Wendy mentions that she has these twin cats she loves. And she said that the guardian either sold them or gave them away or got rid of them. And when they were in some type of a dispute, then the guardian said, well, your two cats are gone. Like, I gave them away. And Wendy says that she has a good friend who verified that she would have taken care of Wendy's cats until Wendy was in a better position to care for them. So if that's the case, then that could be considered psychological abuse. I go into more detail. So yes, check out my Instagram at dr.frita and my Facebook, where I go right after I saw all three of the interviews. I went on and I went into detail about guardianship abuse. So that's different content than that's here on YouTube. So go check those out. But make sure you give us a like here on YouTube. We're about to wrap things up. But I want to know, did anyone comment on Wendy Williams and what they think? Did they feel like she seemed permanently incapacitated? Do they think she needs a guardianship? Just based on the information that we have.
Yes, ma'am. Absolutely. We have a few comments. This one comes in from Zara.
Hi, Zara.
She says, I honestly don't know too much, but my heart goes out to her. I wish she had family around her.
Yeah, me too. Because even if she's not perfect, 'cause I'm not going to say that she was 100% herself, but gosh, I would love it if her niece or if her sister could really guide her decisions. I just don't like the idea of her feeling isolated. That's another thing she mentioned, that she feels isolated. Yeah.
Yeah, I remember Miss Cynthia.
Hey, Miss Cynthia, I remember.
Maybe her conservator keeps her in her meds, just a guess.
Oh, yeah. So that definitely would be a responsibility of the conservator or the guardian in this case to keep her taking her meds. But then my question is, could her sister, who's an attorney, also keep her taking her meds, or could her niece? Yeah. But you're correct. That is one of the jobs of the guardian.
Yeah, and Alicia was thinking more the same lines as you. She said, why can't Wendy's family assume guardianship? Wendy seems lucid.
That's where I am. Yeah. Wendy was sharp. She was funny in these interviews. My heart goes out to her too. And then she only has $15 of cash in her wallet at a time. All of her money is in control of the guardian. That her apartment is worth multi-millions of dollars. I had her at $17 million at one point. But definitely multi-millions. That apartment, it's been sold. Wendy doesn't know how much she got from it or where the money is. Only the guardian knows.
Okay. Yeah. And Misha, Dr. Frita. Hi, Misha. First
Hi,
time checking in. Misha says, after listening to all 3 interviews, it seems like her cognitive issues were due to substance abuse. I feel there should be an independent reevaluation.
Now, ooh, I like how you're talking, because that's another point. They were saying that she had frontotemporal dementia, which is believed to be irreversible and to lead to someone being permanently incapacitated. But she was reportedly drinking heavily. So if she were drinking and doing drugs when we saw her, then yes, she could have had an alcohol-induced dementia, something like that, which could have improved over time with no alcohol. I'm with you. I think there should be an independent reevaluation. See, they need to call us and put us on the case.
Yeah, and Belinda, she kind of along the same line, sort of. She said, I assume Wendy is being treated for her illness. However, does Wendy having Graves' disease make her situation worse? She sounds much better.
She does, yeah, and she is reported being treated for that Graves' disease. And do you remember, if you saw the documentary, her eyes were really out with the exophthalmos, or the proptosis springing from her eyes, and she was very, very thin, and so it did not feel. I mean, she had a guardian, but it did not feel like she was having good care then. All right. Well, it looks like we're running out of time. I did have one more topic I wanted to get into. You know, Shado, we could play that clip really, really quickly, and then we can just answer a couple of quick questions. Quick. We'll give priority to all of our members. So if y'all put a question in, I'll definitely get to yours first. If you do a super chat, I'll make sure I prioritize your question. But then join us on January 27th. That's for the members only live Q&A. We'll spend the whole session where you can ask me all of the questions. And if you want to have an even more in-depth conversation with me, like one-on-one, I do offer a telehealth service, a telehealth concierge service, where I can take your full history and you can have a whole time. HIPAA is in effect for that. That's just one-on-one. I've been having very great results with the patients who come, and you can talk to me from anywhere in the world. So click the link in the description if you'd like to take advantage of this telehealth concierge service I offer. Also, so for the YouTube, for you visual folks, you're probably sitting here watching our faces on YouTube. But guess what? We also have a podcast, Healthy Happy Life Podcast with Dr. Frita, where you can just listen while you're on the road, while you're driving, while you're folding clothes, while you're washing dishes, while you're reorganizing your pantry, while you're mowing the lawn. You can listen to the podcast. So make sure you check out our Healthy Happy Life Podcast with Dr. Frita and give us a 5-star rating, if you please. You can listen to us on Apple, Spotify, or anywhere where you listen to your podcasts. All right. So as we close out, do we have a couple little 1-2 questions? 1, 2, you know what to do.
Yes, this question comes from Sheree. Hi,
Sheree.
Does anesthesia for surgery have a bad effect on the kidneys?
It depends. There are so many different types of anesthesia. So there are certain ones. When I have patients with kidney disease who are going into surgery, then I always will do a renal recommendation or kidney recommendation, and I'll let them know to dose medications at a dose that's safe for my patient's kidney function. For example, if my patient has CKD-3, I'll say dose medications at a dose that's appropriate for a kidney function rate of less than 30 milliliters per minute. So it gets quite technical. But something else with anesthesia, sometimes if an anesthesia drops the blood pressure, because sometimes it can do that, then the drop in blood pressure could cause a decrease in blood flow to the kidneys, and that can be an issue. But yeah, it just depends. Certain anesthesias or a reaction to anesthesia could harm the kidney.
Thank you. And then I'll grab this question from Alicia.
Hi, Alicia.
Is hibiscus tea bad for people with kidney disease?
No, not typically. In fact, hibiscus tea, okay, so it depends. So just in general, hibiscus tea is one of those teas that we have found can lower blood pressure naturally. So if you're someone who has high blood pressure and you have kidney disease and you're trying to get the pressure down, then drinking hibiscus tea twice a day can have similar effects as drugs like ACE inhibitors, drugs like lisinopril, ramipril, benazepril. Here's the trick. Those drugs that I just mentioned, the ACE inhibitors, are great for people, especially when they have early kidney disease related to diabetic nephropathy. But if they have advanced kidney disease and the kidneys are getting worse, then ACE inhibitors like lisinopril, benazepril, ramipril can be bad. So it's a catch-22. So I say consult with your physician, or specifically your nephrologist, if you have CKD already and you want to start hibiscus tea. But for the general population, hibiscus tea can be a way to lower blood pressure naturally.
All right. Thank you, Dr. Frita.
All right. Well, thank you to everyone for joining us today. I hope you enjoy your MLK Day. Please go look up a Martin Luther King Jr. quote or go do an act of service or something. He's really a great man. And again, make sure that you check out my Instagram and my Facebook, where I posted my tribute to Martin Luther King Jr. today. And, but I appreciate y'all for watching. Again, make sure you like us as you head out the door. Share this video. We do our best to give you evidence-based information. And to all of my members, thank you very much. I will see you on next Monday for our live Q&A. And if you're not a member, it's not too late to join. Just click the link, join our membership. In the membership, I give you members-only videos where I come on here, and they're videos that only you will see. You get first look of videos that are released to the general public. In fact, I might have a first look on there for you today for the next video I'm releasing. Take a look, members. I have a first look for you. And then, I have all types of things like that. Oh, and just one more thing I want to share before we go. Raise your hand if you are constantly looking for ways to preserve your youth or have a little bit of anti-aging, and you see all kind of pills and lotions and things of that nature. Yeah. Well, I am sharing a juice where I talk about anti-aging the natural way. And Shador, if you just put that video up for a little bit, just play a little piece of the video, and then y'all can catch the rest of the video. Actually, right here on YouTube, on the YouTube Shorts, you can catch the rest of it.
I'm Dr. Frita, and I want you to make this anti-aging juice with me. Let's start with purple cabbage. It is loaded with antioxidants and can help to reduce the appearance of fine lines and wrinkles. It has vitamin A, which helps to promote skin cell renewal and can help to protect your skin from the sun.
All right.
Purple cabbage promotes.
If y'all just right here on this Dr. Frita YouTube channel, you'll find that short. We just put that up there, and you can see just one natural way to eat certain fruits and vegetables that help to promote collagen, to help to, reduce skin cell damage, to help to protect your skin from the sun. Scientifically shown that's a natural anti-aging remedy. Check that out. All right. But thank y'all for joining. Shador, thank you for being my co-host.
Welcome.
I want all of you to have a wonderful, beautiful day and to do your best to live your healthiest, happiest lives. I'm Dr. Frita, and I'll see you next week. Same time, same place, noon Eastern Standard Time for Medical Monday, where we give you all of the hot health headlines in the news.